what I want to do is I want to introduce our panel members today. And first of all, we've got Kyle Waterman. And Kyle Waterman is a city council member here in Kalispell. He has been civically active in the Flathead. Kyle is the city representative on the Flathead City County Health Board and the chair of the Flathead Transportation Advisory Committee. Prior to being elected to City Council, Kyle was an executive director and fundraiser officer for nonprofits in Montana, Washington State, and Chicago. His most recent non-governmental organization position was with the Intermountain Children's Services here in the Flathead. Currently, he is a project manager for an online retailer in Columbia Falls, Montana. And then
Good morning,
next,
everybody.
thank you, Kyle. It's good to see your face. And then I want to introduce Frank Gardner. Frank was raised in Kalispell, Montana, where he graduated from Flathead High School and Flathead Valley Community College. He became a member of the Kalispell Police Department in 1986, where he worked in the patrol division. Frank served in a number of roles throughout his career, including as a county drug team agent shift supervisor, detective, as a SWAT team leader, and in 1997, he was promoted to chief of police. As chief of police, Frank initiated an aggressive community policing philosophy that led to a number of beneficial programs, including Kalispell's Meeting on Meth, the Major Case Unit, the School Resource Officer Program, and the Police Advisory Council. After nearly 9 years as chief, Frank retired and took a position as police advisor in Afghanistan, where he served as a mentor to Afghan police, a police trainer at a regional training center, and later as the professional police mentor supervisor in the Afghan capital of Kabul. Following his service in Afghanistan, Frank worked as the chief of security for Kalispell Regional Healthcare until moving into work privately as a law enforcement and security consultant. Frank has a long record of public service that includes membership in the Evergreen Lions Club, the Kalispell Rotary Club, Big Brothers and Sisters, the CARE organization, and he was named a Great Chief by the Kalispell Chamber of Commerce and received the Distinguished Alumni Award from Flathead Valley Community College. Frank is about to begin his 4th term in the Montana House of Representatives, where he will serve on the Appropriations Committee with a focus on health and human service policy. He's been married to his wife, Teresa, for over 40 years, and they have 3 grown children who all live and work in Montana.
Thanks. Sounds like I can't keep a job from that, but thanks.
Yeah, I know better, Frank. Thanks for being here, Frank. Good to see you today, too. And then last, we've got Jane Weber, who has been a Cascade County Commissioner for 10 years and has served on the Board of Health for over 8 years. Commissioner Weber has a degree in forest science and prior to becoming a county commissioner, worked 31 years as a federal employee with the USDA Forest Service. Commissioner Weber is committed to her involvement on the Board of Health and respects the science-based advice of her fellow Board of Health members and the Cascade City County Health Department staff. She has been a proponent of needed measures to slow the spread of COVID-19 in Cascade County, and she remains concerned about the high death tolls in Cascade County. I also want to say Jane is, I want to congratulate her. She has put in a lot of years of work and committed services, and she is planning to retire. So thanks for being here, Jane.
Thank you. Glad to be here.
So I feel like we've got some really great people that are going to share their wisdom with us. And I really have this pictured as being an informal session. We'll do some round robin, just a few questions that I guess I could get our slide advanced to. Here's these lovely people. I should have upped my game and gotten to my slideshow. So what I wanted to do was just do some round robin and talk about some of the questions that you see on this slide here. So, we're not going to go in any particular order as far as people, our panel members jumping in. So if you've got something you want to say, please chime in. If you don't, we'll have one of your counterparts take this one. So what do you see as your role in public health? Any one of you that has something to share with us, please chime in.
Frank, do you want to start?
You
Good
bet.
job, Jane.
Sure. So I think I'll start at the end and work my way back. And by that, I mean my role in public health this year, this coming year, of course, will be primarily centered around my service in the legislature. So I've been 3 terms in policy committees, and I'm moving to appropriations this time because we've lost some senior people in there, and we need some people with some experience and with some budget experience, and my private and public experience in that will probably help. And I'm going to be on what's called Section B, which is going to deal with Health and Human Services, which really is the largest part of Montana's state budget. And there are going to be a number of issues in there this year where we take a look at how Medicaid expansion is working and some of the triggers that are associated with it, the services that are provided. You know, we expect that this is going to be a challenging year on revenues, and so we're going to have to try to help make some hard decisions. We'll probably look in the legislature in total at about 1,300 bills in 90 days. So what could go wrong, right? It should be fine. But so that'll be my primary role. But if I back up from that, of course, it's I grew up here, I raised a family here, and my role in public health is that my family benefits from our investment in public health in this community. And for me, that's probably the most important role I play, is making sure that we have a vibrant and effective public health system, because I'm highly invested in the outcomes here.
So Kyle, I'll go next if you're okay with that, because you and I are local government. So I'm at the county level, and so my role is very different than Frank's role in that we have a joint city-county public health department. All the employees, though, in Cascade County are county employees. So my role as a county commissioner is to make sure that the public health department is properly funded. And they are probably about 50-50 grant funded from state and federal grants, as well as county funds. So it's a balancing act. So we as county commissioners approve any grant funds and contracts with our state government or federal funds that come through with federal government. So my role is directly with their budget to make sure that they are properly funded so that they can be properly staffed. And I am very engaged in making sure that I work directly with the public health officer when they have job openings. I'm involved with assisting if she wants me to review position descriptions with the human resources director, because we want to make sure that we get that balance. Whenever there's a discussion about reorganization of our health department, she comes to me mostly because of my role of serving on the Board of Health as the representative for the county commission. Now, decisions with budgets are not made by one county commissioner. They must be made by a majority. And in our case, in most counties too, there are 3 county commissioners. So it takes 2 to vote on the budget. It takes 2 to decide whether we want to move forward on staffing plans. And so I kind of look as my role as intermediary, since I serve on the Board of Health, because I have a direct line with the public health officer on a regular basis to kind of be the messenger back to the body of the county commission and help her convince them of what she needs as far as organizational structure and funding. The other role then that I do play is I serve directly on the Board of Health. As you know, I've been on it for over 8 years. The mission of the Board of Health and my role on the Board of Health is to keep our community safe. Keep it safe. And that's in a number of arenas, whether it's a variance on a septic tank or whether it's the prevention of the spread of contagious disease, which we're all focused on right now. But there are many other things that we deal with public health, dealing with WIC program and our families and parenting, helping parents be better parents by helping them be teaching them some of the skill sets they need, visiting parents in their homes. All of those are the variety of things that we serve in public health, and I want to be able to support those, because when you have a healthy community, you have a strong community. So Kyle, I'll let you take it from there.
Great. Thank you, Jane. And, you know, I'm sort of the opposite view of where Jane is. I mean, I am a city council member on our city county health board, which puts me in the role of representing sort of the Kalispell city interests. And that's one of my primary roles. When I got elected to city council, there was actually some public health issues which I was concerned about, and I sort of looked at it, sidewalks as being some of those, and some of the accessibility, and because I had worked at Intermountain Children's Services, was really interested in trauma-informed trainings and how we could do that. So I sort of gravitated to wanting to be on the health board originally for mental health reasons, to be able to talk about community health and talk about suicide. As Jane mentioned, I mean, then I ended up sitting through a lot of the septic reviews and everything else for the first couple of years that I was on Board of Health. And so there I was really just trying to keep at my personal priority of why I was there, and something I thought was interesting for the city. But then, of course, when we moved into this last year, I mean, communicable health is actually much more an urban health issue. And so then that really became my life. We've been going through an interesting year where we've had some transitions with our health board. I think the other thing is that because I have a nonprofit background and just a good board governance background, I am the chair of our personnel committee. I'm on our budget committee. I then am pretty active on the board and helping making sure that we move things forward. As people have watched the Flathead County Board, we've had a little bit more issues, and we ended up having to hire a new. I'm there to also advocate, be a go-between between the city and stuff like that. So that's sort of my role.
Great. Thanks to all three of you. And that does give us good perspective of the varying degrees of involvement that each of you bring with different levels of political involvement. So thank you. So how do you prefer to have communication or education come to each of you? And what I'm talking about here is, you know, do you prefer somebody to show up at your office? Do you prefer to have a letter or an email? And also recognizing the answer probably changes based on all of the context around that. Like Frank, I would expect you heading into a legislative session to have some different ways that you prefer to receive education during legislative time. So if each of you can just talk through your preferences, that will help us as public health professionals know how to work with our elected officials.
So Frank, I can go first this time.
Okay, go right ahead.
So, you know, as Holly said, you have to be adaptable. So let's just talk about the beginning stages of the pandemic. When we did not have any cases in Cascade County, I got a text every day from the public health officer about 6 o'clock in the evening. And she would say, no cases again today, no cases again today. And what I did was I immediately called the staffers for the two senators' office and our representative here in town. So Gianforte's office, Daines' office, and Tester's office, and kept them up to speed, because the public health officer doesn't have time to do all of that. And I'm an official that's elected, and I could talk to them directly. So we were doing that at the beginning. As soon as we began to get cases, then there was a lot more conversation going on about, do we need to be standing up an emergency operations center? Who should be on the emergency operations center group? We had been talking about this ahead of time. So that wasn't like starting from nowhere. We get EOCs up on a regular basis dealing with fire over here in Cascade County. So we have kind of a set group of people, but the emphasis on this was different with the pandemic than a forest fire. So we stood that up, talked it, and we did that jointly with the city. So it was a city-county organization, and got the position in place. And then we engaged all of our health organizations on the EOC. And we do now, as it progressed, we were having meetings in person, and then we decided not a good idea. So we do a weekly Zoom, and we have our hospitals, our clinic hospital, our clinics, our disaster emergency services person, our health department, our local nonprofit group that is providing health to our community healthcare center. We also have the chief of police, we have the fire department, and we have the emergency ambulance folks. Every Wednesday at 10 o'clock in the morning, I know exactly where our hospital is at relating to whether they're at 110% occupancy, how many are in the ER awaiting a bed, not necessarily a COVID victim, but somebody awaiting a bed, how many are in ICU, how many are on ventilators. That kind of detail is really important to have as a county commissioner. So when I get a phone call from a constituent and says, our hospitals are being filled up totally by our rural community, and we need to stop having our hospitals take in patients from the rural area because they need to make Great Falls their priority, I can say, wait a second, your information, number one, is wrong. Number two, we're a regional hospital, so yes, we do assist our rural folks who don't have the capability in their hospitals. And so, it just gives me the data and the information so that I am able to respond to a constituent who is passing on false information. Now, the other thing is when something comes up that I need to know about right away, the public health officer either calls me or texts me so that I am never caught unaware by a constituent without emerging information on hand so that I can respond. I never want to have a cold call from a constituent without knowledge base behind it. So as an elected official, that's probably the most important thing to remember is don't ever let your elected official get caught with their pants down. They need to be advance noticed. So I'll just leave it at that.
And I'll jump in real quick. I mean, just sort of to echo what Jane is saying. I mean, I think it is nice to know it in advance about information. I think it depends on what mode of communication I'm being overwhelmed by. Sometimes the alternate, a phone call is really appreciated when I'm getting a lot of public comment via email. So having some direct communication, but also sort of knowing your elected official and what their preferred means of communication is just really important. And it's something I would encourage you just to ask that upfront. Do you prefer call, text, email? Because I really like a phone call because sometimes it's just faster than the onslaught of emails that I'm getting. And like Jane, need to be ahead of the curve to be able to get the information. So that's how I prefer. I also, obviously prefer to have it come in an alternate time, like not right before a meeting. I sort of want those alternate scheduled times. And I'm not bad about getting things in the weekend. I sort of appreciate that when I have a little bit of a shoulder time where I can actually digest educational information.
And I'll add a little to what they've said. First, my preference on communication is that it comes on a note attached to a box of cookies. That's my favorite. But if it comes otherwise, it's by phone or by email. And I'm going to mention a couple of things. First, you're looking at my office. It's a bedroom in my basement. We're citizen legislators. We share staff during this session. You're also looking at my staff, and it's pretty tough to get fired in this job. So we handle our own calls, our own emails. And if you get used to using the Montana Legislative website and you see on there all the legislators posted, they have emails, mailing addresses, and phone numbers. And for most of us, those phone numbers are our personal cell phones. So when you look on that website, you're going to see my personal cell phone and you can call it. And I think this is one of the most important things I think that I'll try to emphasize today is that during every session, you are going to communicate with us whether you know it or not. If you don't call us and give us your opinion, you're communicating with us, right? And you're telling us this isn't important to you. We're not getting the professional advice or input, because on many of the big bills, I'll get between 1 and 200 communications, right? Most of those are not from people in my district. Many of those are from people out of state. So lots of people are communicating with us, trying to influence our opinion, and it ought to be you. So if I won't ask for a raise of hands on how many of you have done that with your legislator. It is imperative that you do, that you know how to, and that you communicate with them, because during the session, I prioritize those communications that come from people in my district, because so many of them don't. And I try to make a point of trying to get back to them. So I would say, make sure that you look at that website, you get used to it so you can watch hearings on it, you can communicate with people, because in this upcoming session, there are going to be a number of very important policy decisions involving public health. Everything from what are the powers of the governor related to declaring an emergency, to the authority of local health officials. And there are bill titles that are already in preparation for the session. So in a average session, before you can make a bill, you have to reserve a bill title. Only legislators can do that, and so they can actually submit them for a bill. There are already 3,000 bill titles that have been requested. So, you know, it's one of those you need to pay attention. This is going to be a big year, I think, on public health, both policy and funding wise. And it's important that you find a way to communicate with your local legislator.
You know, Holly, I'll just add a little bit to both what Kyle and Frank have said.
Great.
Here in Montana, government is small, no matter what level you're at. And so just like Frank, I'm working from home right now because of the pandemic. All of my phone calls from the office get diverted to my cell phone. So, and my cell phone number is given out pretty freely also. And so I think Frank is absolutely right. Make sure that you're communicating, but Kyle's also absolutely right. Find out how the individual in your local government wants to receive communiques. Because when it's really important, my public health officer knows to pick up the phone and call me. Otherwise, I received a text on Friday evening at 8 o'clock at night about a situation that involved another department head relating to our vaccines for flu vaccines and our COVID testing over at our fairgrounds. And that came from the fairgrounds person, and she communicated that to not just the commission, but also to our health officer, because it was a connected complaint. And so, you know, it's just nice to know how do they want to receive it. So Kyle, that was a really good point. And Frank, the point that we just deal with our own texts and emails, we all do mostly. Yellowstone County is a bigger county. They may have buffers, but we don't have buffers.
And I really did appreciate, Kyle, your feedback there on just asking the question. So, you know, I think if everybody heard that when you have an opportunity to speak to your elected official for the first time, that's a good question to just put out there of, if I'm reaching out to you, how would you like for me to best communicate with you?
Yeah, and again, I do think it is a good front end question that gives some courtesy to the elected official. And as Frank and Jane are both saying, and I think it's also really important to do a little bit of research about who that person is, because I'll tell you, if you know, we have on our health board, we have 2 doctors. You just have to remember that they have clinic, and they're not going to respond to you between 8 a.m. to 4 p.m. So yeah, take some mind a little bit, because a lot of elected officials do have other jobs, and you have to take in mind what they do.
Yeah. Great. And I did take note, Frank, that I've reached out to you many times and I've never brought you cookies. So I've now added that as a list of things to do with Frank is cookies. Sorry that
I just have to tell you that yesterday I delivered cookies to the health department. So it goes both ways.
It does.
Very nice. Very nice. I'm sure they were so grateful. So on to our next question. I don't know if the 3 of you want to add anything on when you prefer to receive that communication. And I think we touched on it a little bit there, but if you want to add anything to your preferred timing of getting that information or education, please jump in here.
I'd just say to remember, in a month, we will be voting in the legislature. Right? So the time to communicate is now.
Thanks, Frank.
I was going to say, I always like it early. And I think that, you know, when you're not up against time frame like where Frank is. I mean, legislation is coming up, you're going to need to rush it in. But right when you're elected is actually one of the best times to get tours and to get introduced to things. I mean, like, catch them when they're fresh.
And I'll just add that, then when they're in their role, when an issue comes up, get a hold of them so that they're not caught off guard.
Great. Thank you guys for weighing in there. So earlier, before you all joined in with us, and I did share my slides with our 3 panel members, but we talked about leave behind documents. And what we were really talking about is trying to capture the gist of whatever public health issue we're presenting or, wanting to engage you in, trying to come up with a resource that is short, sweet, to the point, and has what you need to relay that information onto somebody else. So could the 3 of you just share, do you have preferences on receiving a document like that, and what is included in such a document?
Kyle, do you want to go first on that?
Sure, I'll jump in first on that. What I really want definitely on a leave behind is something that's going to remind me, jog my memory of what it looks like. So image right on the front and a phone number. So that if I need to go back, I can be like, I just need to go find that person's business card. I mean, so I think having that sort of prominent is really good. I personally, if you can get somebody in for a tour, I think that's the best time to deliver a leave behind and connect somebody with stuff. I think that's, I have to say, in my short time of being an elected official, the tours are the most memorable time where I actually got some personal time, but also know that I was being the most educated about the mosquito program or about the places where people have used tours on me that have been the things that I remember the best, and I know those details the most.
Hey, Kyle, can I ask a question on that? So as we think about your answer to that during a time of a pandemic when everybody's stuck at home in their offices, what would be your preference during a time such as right now?
I still think that it's important to be able to show a little bit behind the scenes of how things are being, the decisions are being made or how things are being processed. Maybe it's not appropriate to always do a tour right now, but I think being able to share a little bit of that, elected officials they love a story and they like to be personally connected to something, and I think it helps us jog our memory if we're able to be like, I have a personal connection with that person. I know sort of the ins and outs of that, or I know what the office is going through. It gives us a little bit of attention to it.
Thanks.
So I think there are ways that you can also right now be doing it with sharing photos about I would personally recommend to my health officer, some photos of what our call centers are looking like, or like some idea of like the changes that we've made in physical plant. There's different ways to do tours.
Okay, thanks.
And I would say that I see that Kyle completely agrees with me on this, because I'm a visual learner too, and so it really helps for me to see the problems that you're having, the solutions, people out doing the work. That's what sticks with me the best. I like graphs and those kinds of details in, but limited writing. I've got about 500 pages I'm wading through right now in preparation for this work on section B of written material, and that's tough to slog through. So, personal connection, it really is about relationships and being able to contact people and seeing what needs to be done and the work that's being done for me.
Well, I'll just add that, with my years with the Forest Service, I had a supervisor that one time that said, if you can't say what you need to say in 3/4 of a page on a piece of paper, then you haven't really thought through the problem well enough. So short and sweet and direct and talking points is important. So I agree with Frank and Kyle in that regard. The one thing that I also think folks that are in the public health industry do need to do is let your elected officials know through your health officer, obviously for chain of command, if you've got concerns yourself. hopefully the public health officers have a relationship with their elected officials. So I'm just going to give an example. I was avoiding going over to the health department. I knew that there were quite a few folks who were working remotely from home, but there were people over there, and I'm working remotely from home for safety reasons. And I got the word through our human resources director that they felt a little abandoned. They felt like we didn't care what they were doing. Even email messages that I was sending every couple days to several of the key people in the health department, they felt a little abandoned. And so I have made it a point now every week to just stop in and do a walk through the health department, thank them for what they're doing, ask them how their contact tracing is going, just checking in with them. So, you know, and I wouldn't have known that had not that information gotten back to us. So if you have a need in your health department for morale assistance, there's ways to just get that information to us so that we can help in that regard. So I toured mine just yesterday and last week, Kyle.
Thanks, Jane. That's super helpful to hear. All right. So moving on to our next question, what would you like public health professionals to consider in order to be good partners with yourselves or other elected officials?
And I'll jump on in on this one first. Is I think the first thing for you to consider is I've never done your job. And there are 100 of us in the House, 50 in the Senate, and the majority of those people, almost all of them, if not all of them, have never done your job. And they are teachers and firemen and policemen and ranchers and business owner and retired folks, right? And so talking to them in a way and explaining it to us in a way that understands and takes that into account that we've never done your job. And many of the folks I work with, they don't know what an allowable is, or an EOB, or you know, any of the work that you have to do out in the field, or the difficulties you have in the day. So I would say start from there. You know, try to communicate with us with the understanding that we really don't know your job, we haven't done it, and we want to do the best we can to understand it.
And I'll jump in real quick as a follow-up on that. Don't assume that everybody understands the scientific process. I mean, I think that sometimes when you approach an elected official, or be able to show that, my example is just that you need to sometimes like teach them how to teach others. You need to sort of be like, well, this is what makes this the scientific process. Don't just, I hear that jargon being like, you know, this is evidence-based or this is scientifically proven. Don't assume that your elected official really understands that entire process, or could help explain somebody else. And so don't, I don't mind being talked down to, especially if I'm being educated. If I feel comfortable in it, I'd like to know the entire process to it. And that's sort of helpful to know, okay, well, how are we going to identify that positivity rate is going down in the community? What is the scientific process that we're going to know that vaccines are going to work? Because we end up having to answer so many questions to people that it's helpful for us to know that process. And I've been surprised how far we got into this year, where we had a lot of elected officials who really didn't understand the scientific process. And it just needed to be sort of broken down to them, being like, we don't know enough, have enough data about COVID to be able to answer that, and be able to like keep them educated and sort of break down the process in this. And I see the same thing about masks. I see the same thing, like sometimes just like, don't assume that they are up to speed with you as much as you are. If they have some questions, they'll tell you to go faster if they want you to, but like I'd start really rudimentary sometimes, because that's some of the answers to the questions that you get from the public. It's like, why mask, or why is this the scientific process? So give those tools.
So I don't have much to add. Frank and Kyle kind of nailed it. The only thing I will add is that stay calm and speak the truth. Don't be rushing to a fire or having us feel like it's a fire when it's not yet a fire. but let us know when we're approaching a fire, because we don't want to have a panic when there isn't a panic, but we want to be ready so there is no panic, that we're prepared for it. So be honest, if things are getting overwhelming, I would really appreciate it knowing that we couldn't keep up with the contact tracing. So we could talk about what are some alternatives? Can the school district assist us? So what happened was jointly we figured out other opportunities for making things a little less stressful over at the health department. Not that it has eased it a lot, but I think there have been some things that have helped. And that's because they spoke the truth to the county commissioners, and we tried to figure out together what we could do, and the Board of Health.
I think that's great, Jane, especially as we talked about, some things are, coming at us so fast that I think we tend to run out the door like we're on our way to a fire, and we do respond too quickly. And so, keeping in mind the short, succinct response, giving you what you need to know, and being very thoughtful about it, like taking that extra moment to really prepare our message. And, we've all seen people respond with what they're greeted by. And so if I show up with my hair on fire, it's probably going to be really hard to hear my message versus coming in, took an extra moment to catch my breath and really think through what I wanted to say. So I think that's important as we work through timely issues that need attention right away. Be wise, take that extra moment, and be sure your message is relayed the way you want it to come across. Great. So on to our next question. Do you have any additional bits of wisdom for public health professionals who will be working with their elected officials? And this is really just an open door for what are the nuggets in your brain that you want all of us to walk away with?
So I'll just give two things. One is we don't bite. We're approachable. Get in touch with us. Don't be afraid to communicate. And one other thing that we do on a regular basis in Cascade County, which I think is really helpful, is we do one-on-one meetings with our public health officer every other week. And that doesn't mean if there isn't an issue in between there that she needs to communicate, that she doesn't communicate it, she does. But when you do a one-on-one and we dedicate 1 hour, and we have given that time over to her to decide what she wants to talk about. And she actually creates the agenda. And usually it's just a quick email to us and say, these are the 4 things I want to talk about today. And I'll see you at 1 o'clock. And it's on our calendar. And it's really been helpful because it's built that relationship with the county commissioners, as well as given her the opportunity to speak what's happening.
And Jane, I just want to add to what you said there that, I think what's critical is you meet one-on-one with the public health officer, and that's just know that in your role in public health, everybody who's on this, your public health officer does not know what's going on in your mind unless you communicate that message. So Jane's not going to get that message unless you've gone through your chain of commands and communication to be sure that your health officer's informed about topics going on. So just be sure to open your internal chains of communication. Kyle or Frank, do either of you want to weigh in here?
Sure, I'll just jump in. I just recently heard this and really sort of think this tidbit of advice is great. When working with elected officials, remember that they're like teenagers. They respond well to flattery, attention, and peer pressure. And I just would, that, and in reverse, remember that they don't respond well to threats. So it's important to find some ways to complement how what work is being done, and that you can always get the press attention onto public officials so that they have that. But also peer pressure, again, if you can find, if your message isn't getting through, go find a peer of theirs to talk to them. Like I regularly am doing this right now in Kalispell, where sometimes I'm not breaking through to be able to talk to our county commissioners. So I enlist the mayor to help me talk to the county commissioners. I mean, I think that, again, finding those peers, but also, again, be careful of criticism and threats of public officials, because again, like teenagers, they're reactionary to that. I recently just had somebody who gave public comment and about a report and was like, this report should receive an F minus, 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 minus. And she definitely has since then been like, well, maybe I shouldn't have said so many minuses. And just remember that, like, because that statement just dug her into a hole, which was we've been working to get her out of in public comment. Really rewarding and fun to say something like that, but sometimes remember that that's going to cost you relationship building. And again, if you're going to criticize a public official, give them a little bit of heads up. Be like, I'm upset about this report, or I'm upset about this, and I'm going to end up going off after that, but I'd like to have an extra conversation with you about it. Just don't shock them.
And I'll just do a summary, because I think Kyle and Jane both did a really good job of identifying a lot of the important points. But in the legislature, starting in January, I'm going to vote over 1,000 times in 90 days. I'm going to get thousands of communications. We're going to look at over 1,000 bills. And so how do you want to distinguish yourself with me on your opinion on something that counts? And my point about it is, it's about developing relationships. I'm supposed to be packing Christmas boxes right now to school, but I'm here today because Holly told me I would be.
Thanks, Frank.
And it's because we have a long developed relationship. I respect her, and I recognize that this is important. It's the most important thing on my calendar this morning. So when I get into the legislature, if Holly calls me, she's going to get a call back, and I'm going to talk to her about whatever that issue is. And so it starts now in developing those relationships, making people, we don't have to, agree on everything, but we do have to be able to communicate. So develop those relationships, make sure you know how you can communicate with people, and then do it, right? And do it before I'm sitting in the seat to vote on whatever the issue is. Make sure that you have that ability to, and you know who those people are that are decision makers and policy makers.
Yeah, thanks. And I will vouch for Frank that I have called him and multiple times, and he's always really good at getting back to me in a timely manner. So I really appreciate, Frank and I've known him for a really long time. Not that either one of us are really that old, but
Right. And not from the old job, not from the old job.
Right. He arrested me. No. No, I've known him for a long time, and I know that I can call Frank and he's going to listen, and maybe we won't always agree, but that's okay. At least we've had a good conversation. So great. Well, I think that we're coming right up on 10. So I want to be conscientious of your guys' time. We took an unexpected break leading into this. So I don't know if you have a few more minutes to just join us to open it up for questions and answers. And if not, please, I'm getting thumbs up. Are you okay, Jane? So let's just open it up for, maybe 5 or 10 minutes of questions and answers, and then we'll wrap up and let these fine folks get back to their important roles. So feel free to type into the chat if you have a particular question, or unmute your line and ask your question. You've got the experts at your fingertips right now.
Yeah, this is Matt Ringler, DPHHS. So when speaking to elected officials, what's the appropriate balance between statistics and stories? Because statistics are more objective and are probably more encompassing what's really going on, but they don't necessarily pull on the heartstrings the way a good story does. So is there an appropriate balance, or does it vary a lot depending on who you're talking to? If you're talking to the legislator for say 15 minutes, should it be 10 minutes of story and 5 minutes of statistics, or 10 minutes of statistics, 5 minutes of stories? What's the appropriate balance there?
Yeah, for me, I'll since you mentioned legislators, I'll say for me it's 10 of story and 5 of statistics. That's what sticks with me. Maybe bring a couple of crayons too if it's required, but you know, it does depend on the people, right? Some people function better with data, spreadsheets, you know, that kind of information. So knowing them and, you know, adjusting your style and delivery is always beneficial. But for me, I like having the data, but I want to see how it's working in real life.
And I agree with Frank. I mean, you have to, like Kyle had said earlier, you need to know who you're approaching. So do a little homework in advance so you know how the person reacts or what they want. I'm a person who likes the data. I like a story that relates to the data, but I don't want to spend all my time on just a story, because then I feel like I'm on 2020 or something on TV. So I need the data to help me, but the story just backs it up.
Yeah, I would agree. I mean, story is always going to be the most helpful. But if you're going to give data, again, I would just encourage, like, peel it back a little bit. Don't just drop a data bomb on somebody. Be able to explain, like, why either that's valuable data that you're getting or where it's coming from. I mean, always, like, maybe go back in time a little bit and explain a little bit of the story of how you got that data or what the sources are. Because yeah, it's dangerous just to leave a politician with a graph that they don't understand. Because if they cite it and can't explain it, then they're not going to trust you and they're not going to trust that data. So
Great. I have a couple questions in the chat here, really quick and easy ones to answer. So first of all, thanks for your time is the comment here. And why does there seem to be a push to remove some power from local health departments at the state level? There seem to be several proposals about that. So I don't know if any of the three of you want to weigh in on this. I know it's something that's
Well, and I can take a stab at both those real quick because
great.
both are related to state legislative service. And I would say to begin with, the reason that there's a number of those is because you see in the legislature some of the conflict we've seen at the local level reflected in these policy proposals at the state. You know, I think Kyle talked about it a little bit, right? Some of the challenges that have occurred between the role of public health officials and what they see as the role of the elected official. So for instance, one of those proposals is going to be to have the commissioners be the line of appeal, if you will, on local health official actions, so that commissioners would have to weigh in on anything that is appealed from an action of a health officer. And then I'll just move quickly to the seatbelt law one, because I carried that bill last time. It was the 9th session in a row that bill has been carried. It dies usually in committee every time. And it is really kind of the difference you see in Montana from rural and urban Montana, where you see a lot of urban legislators support that legislation, and you see a lot of the rural ones that don't, where they don't necessarily see the benefit when they're driving down the gravel road out in the middle of eastern Montana. I mean, that has often been the case. We also had some pushback from the Native community, where they worry that that having a primary seatbelt law is another reason for law enforcement to stop them. And I've talked to them and their caucus about that, and we've tried to put some controls and measures in place to help alleviate that. But those are some of the challenges that come up when we look at the primary seatbelt law.
So Frank, if you don't mind, I'll just tag on from the county commission perspective on what I think is happening with some of the directives and authorities that the Board of Health and the public health officers have. You know, the mission of the Board of Health is very different than the mission of the county commission. The county commission is hearing from businesses only. That's who they're hearing from, businesses. And the Board of Health listens to businesses too. When we did directives for our decisions in Cascade County, it took 2 or 3 meetings to come up with the last set of directives. And that was because we had 104 people in the meeting. all of which, if they wanted to comment, were able to comment. So one night was just spent listening to comments. But in the end, we had a discussion with the Board of Health, and our Board of Health is 7 members, 4 of which are healthcare providers. The only 3 that are not is the county commissioner, my role, a city commissioner, and the superintendent of public schools. The rest understand health. And so, you know, when it comes down to it, it's the role to protect the public health of the community. And that's what the Board of Health is set forth to do. County commissioners really have a concern about business and economic development. And I think it's a mistake to take away the authorities of the public health officer and the Board of Health, because I've seen it with another whole realm in county government, which is called the Zoning Board of Adjustments, which you guys don't have anything to deal with, but it's in the planning world. The Zoning Board of Adjustments, like the Board of Health, is an independent decision-making body. They have the authority to do that. And there was legislation a couple years ago that gave the authority for appeals to come back to the county commissioners. It doesn't work. We've already had that happen in Cascade County, and now it just delays. And it's eventually going to end up in the courts if somebody wants to take it that far anyway. When you're in a pandemic, the boards of health need to be able to make the decision. It takes long enough for them to make that decision if they're doing it right with public comment. If it then gets appealed to county commissioners, geez, are we going to be up to 125 per 100,000 cases before it gets a decision on it? I think that it's a very bad movement that's in the works, and I will oppose it. Even when I retire as a county commissioner, I will be over at the legislature opposing it.
And I'll just jump in. I mean, I think that, yeah, we can see the changes coming, and we can see sort of the reaction to 2020. I think a part of it is it's important to raise up that, give the other health examples, but also again lean into. I would encourage leaning in a little bit to. Somebody once also told me that you know, the reason we call it politics is that if it was logical, we would call it logic. So I mean, I think that really pushing in on people to be that you know, you don't want to make this rational decision in a political manner, and be able to sort of help politicians understand that you know, here's another example of measles outbreak of where it would be, or look at these other authorities, as Jane's pointing up, that it just wouldn't work there. It's not going to work in public health.
And I see another question on there too that I want to try to grab before we get done, and that is essentially if the if the legislature doesn't really understand the role of public health in the community, how is it that they're going to weigh in heavily on what that role is and on changing it? And so it goes back to one of my earlier comments, that part of the problem is you have 150 people there that don't do your job, right? For a lot of people 2 years ago, public health had something to do with that little letter grade you saw in the restaurant when you went in, right? And now public health means something entirely different to everybody. It's really at the center of a lot of what we see involved in public policy that touches them in their lives every day now. So you've seen this huge shift, not because of anything that you've done, but just really because of the conditions in the world. And now you have a bunch of people that didn't even know the thing existed 2 years ago trying to make decisions on it. And like I said, we meet 90 days every 2 years, and you've got to kind of be prepared for that policy shift. And for 30% of them are going to be brand new people that have never walked into the Capitol before, legislators. So that's why those communications have to start early. You've got to have those relationships, and those are the people that are going to be making those policy decisions. So reach out, do the best you can to try to educate them on what you want to do. Other people are going to. And I want to hear from the professionals, the people that are doing the job every day. If you don't, somebody else is gonna.
Great. Well, I feel like we could keep you guys for the rest of the day because you've got so much good information to share with us, but we won't do that because I know you've got other things to do, and I'm sure that phone there, Frank, was the school calling to see why you're not there packaging Christmas gifts. But anyways, I do want to say a huge thank you to each of you for joining us today. Remember that your elected officials, you guys, these 3 panel members and your other elected officials, they're here to represent you, to be your voice. They're not scary people. I certainly felt like none of you were scary today. Really good information. So build those relationships, stay in communication with your elected officials. And thanks to each of you for being part of this important conversation today. So wish you well, stay healthy, keep up all the good work, and hope that you get some nice holiday time ahead.